Hi everyone, if you're new here, I'm Dr. Lewis Kren, family medicine physician. And in today's video, I'm going to cover two different topics for you. The first item I'm going to cover is the recent update to the Pfizer BioNTech COVID-19 vaccine emergency use authorization. In case you haven't heard, the Pfizer vaccine is now approved for ages 12 to 15 in the United States. The second topic I want to cover is the recent update from the CDC to the masking guidelines for the United States. Hopefully we'll clear up some of the misconceptions that are out there about these changes. All right, let's get started. First, let's talk about the recent update to the Pfizer BioNTech COVID-19 vaccine to include now persons ages 12 to 15 in the United States. There's been a little bit of controversy to this announcement, and there's people on both sides of the debate of whether or not we should really be focusing our attention on vaccinating younger and younger age groups, or if we should perhaps be sharing the vaccine with other countries around the world. So first, I want to talk about why I think it's important that we include this age group in our vaccination programs. Now, I understand that a lot of kids in this age group do not necessarily get sick with symptomatic disease, and even fewer of them end up with severe disease. We've seen that throughout the pandemic, although the incidence of disease in this age group is not as low as we originally thought. And especially as persons in the older age group become immune either from natural immunity or vaccine immunity, that leaves the virus with only one place to go, and that's younger and younger individuals, and it's going to continue to replicate through those individuals unless something stops it. Vaccine is, of course, very good at doing that. So the data that was presented to the FDA and CDC that led to the vaccine being approved for this age group showed, thankfully, that the vaccine is very effective in this age group, and there were no new unexpected side effects other than what we've already seen in the 16 and older age groups that was previously presented to the FDA and CDC. So, as we expect, highly effective, minimal side effects, and thus a very safe, effective vaccine. Other reasons why I think it's important to go ahead and vaccinate this age group is not necessarily because we're really worried about these kids becoming extremely ill, although it can happen. And unfortunately, if you're sick enough as a child to end up in the hospital, there's a 1 in 3 chance that you'll actually end up in the ICU, potentially with multi-system inflammatory syndrome, which can lead to some, unfortunately, fairly negative outcomes. There's also the possibility of kids developing long COVID, just like adults. But beyond that, I think it's also important to vaccinate children because if they don't get sick, they can't take it home and spread it to adults or their elderly relatives. As we look to the fall and school starting back up again, it's also important that we protect not only our children, but also our teachers so that we can have in-person, face-to-face instruction rather than this virtual school that we've had for the last year that unfortunately really hasn't been as effective as we would have liked, and certainly is not as effective as being in school. Now, on the other side of the debate is the idea that perhaps we should be sharing our vaccine with other poorer nations who haven't had the ability to vaccinate their older, more vulnerable populations yet, just simply because they don't have access to the vaccine like some of the wealthier countries around the world do. I think this is a valid argument, and fortunately in the United States, the vaccines are very plentiful. I tell people right now, you pretty much have to try not to get the vaccine. There's so many available, especially in my area. I know there are still places around the country where maybe it's not as available as it is in my area. But I don't think it's as easy as just boxing it up and shipping it to some of these poorer countries. It kind of reminds me of when I was a child and my mom used to say, clean your plate because there's starving kids in Africa who would eat that food if you don't. And my smart aleck response was, well, then box it up and send it to them. I don't think it's as easy as just box it up and send it to them. Unfortunately, especially with the Pfizer and Moderna vaccines, they require special handling and special storage in freezers that may not be available in third world countries or some of the poorer nations around the world. So I don't think it's as easy as just box it up and send it to them. Now, the United States did recently announce that we are sending millions of doses to poorer countries around the world, including AstraZeneca, Moderna, Johnson & Johnson, and Pfizer vaccines. I think there will be some logistical challenges to this, but it's good to know that we are sharing with the world because unfortunately, we live in a world that's interconnected, and if we don't vaccinate around the world, we really can't feel safe in our country or in your country if you're in one of the richer nations that is vaccinating the population at a faster rate. We really can't feel reassured because somebody could easily come from one of those poorer countries, bring the disease with them, perhaps a new variant that isn't responsive to the vaccines, and we're starting all over again. So I do think it is rational and reasonable to share some of the vaccine, but on the flip side of that, I also think it's reasonable and rational to continue to vaccinate younger and younger age groups, not only to protect them, but also to protect others around us, because we still haven't reached that level of immunity, either from natural immunity or vaccine immunity in our communities, to stop the spread of the disease effectively. This is important because that not only keeps people from getting sick, but it also keeps new variants from being created, because new variants are created when the virus is allowed to just replicate unchecked through individual after individual after individual. So we need as many people locally, nationally, internationally, to take the vaccine as are willing, including younger age groups. So I hope this commentary gives you something to think about when you're considering whether to vaccinate your children or not. I will say that my son is fully vaccinated because he was old enough actually to be in the previous group, and my younger daughter has actually started her vaccine series with getting her first vaccine last week, and I hope to in the near future publish a video interviewing actually them and discussing what it's been like for them during the last year during this pandemic, especially with a physician as a father, but then also get their take on why they actually wanted to be vaccinated against COVID-19. So if you would, let me know in the comments what your thoughts are about vaccinating the younger age groups and whether you plan to get vaccinated yourself or whether you plan to vaccinate your children or not. Okay, so let's move on to the next topic. Let's talk about the updated guidelines from the CDC on masking. And I want to break this down as simple as I can into a couple of different groups. The first group is if you're not fully vaccinated. Now, let's define first what it means to be fully vaccinated. Fully vaccinated is 2 weeks after your last vaccine. If it's a vaccine that is a 2-dose series like Moderna and Pfizer, then it's going to be 2 weeks after that second shot. If it's a single shot vaccine like Johnson & Johnson, it's 2 weeks after your single vaccine. So 2 weeks after your last shot, whatever that is, you're considered fully vaccinated. All right, so if you're not fully vaccinated, then really nothing's changed. You should continue to wear your mask indoors especially. If you're outdoors, really, the CDC clarified this a couple of weeks ago that it's probably not necessarily to wear a mask outdoors, unless perhaps you're going to be in a crowded, elbow-to-elbow situation like at a concert or perhaps in a densely populated area where you really can't physically distance from somebody. Other than that, there's no reason to wear a mask outdoors. The virus, if it is around you, dissipates in the air pretty quickly, and there's really limited risk of being infected. But if you're indoors, the CDC does recommend that you continue to wear your mask, just like has been recommended for the past year and a half. If you're fully vaccinated, this is where things change. The current guidelines are that if you're fully vaccinated, you no longer need to wear a mask either indoors or outdoors. Now, there are a couple exceptions to this rule. If you're in a hospital or physician office setting or other healthcare facility, then it doesn't really matter whether you're vaccinated or not. The guidelines are to still wear a mask. And I know if you come to my facility, you won't be allowed in unless you're wearing a mask. And that's going to be the case, I suspect, in most healthcare facilities. The other exceptions that do not matter whether you're vaccinated or not is if you're on public transportation. So if you're on a bus, train, airplane, in an airport, in a bus station, or bus terminal, you're going to have to keep wearing your mask. The TSA came out and reaffirmed that they are continuing with their mask guidelines at least through September. So if you don't want to face any huge penalties or fines, I suggest you continue to wear your mask on public transportation. The other place where you may still be required to wear your mask, again, regardless of your vaccination status, will be if certain businesses or employers require it. Now, the guidelines are just that, guidelines. Businesses and employers are still allowed to make up any rules that they want to. If they feel it's necessary for the safety of their employees or their customers, then they can still require masks. Just like any state or local municipality can also continue with their masking guidelines. Now, a lot of businesses and a lot of states and local municipalities are starting to drop their masking guidelines, but I encourage you to follow up with your local health department to see what rules and requirements you still have. I know in my community, our masking rules will end in a couple of weeks. So even if you're fully vaccinated, you're still required to follow any guidelines that state, local businesses or employers have for you, regardless of your vaccination status. So I hope that helps to clarify the guidelines. It really is pretty cut and dried. If you're not vaccinated, nothing changes. If you're vaccinated, then it potentially changes, but you'll have to check with local guidelines and any places of employment or businesses that you might frequent. All right, thanks for watching. I hope this video's helped to explain why I think it's important that we vaccinate all eligible individuals, as well as cleared up some of the confusion around the new masking guidelines. Please leave me some comments down below if you have any questions about the vaccines specifically. If you're hesitant about getting the vaccine, I'm certainly willing to answer any questions that I can or point you to resources that you might need to help you feel more comfortable about taking the vaccine yourself or giving it to your children. Please consider liking this video. It helps other people see it. And as always, be safe out there.